All right, welcome to another episode of Real Physician Reacts. I am yours truly, Dr. Pierre, your favorite board certified internist. If this is your first time catching this series, this is my series where I kind of give the doctor's reaction to something that kind of comes across my visual field, whether it be something on my social media platform, something that someone kind of sends me in a message, a text message, a DM, whatever. I kind of give what would a doctor or a typical doctor, especially like myself, how am I going to respond to that? And this video comes straight off my TikTok feed. It was a video that it has a lot of different layers and says so much in such a little time, right? Again, if you just read the title, you know how to deal with expensive hospital bills. I think it is such a multi-layered issue of not only dealing with hospital bills, but like why the hospital bills are as expensive as they are. And I've talked about this before, especially on either the podcast or this kind of series here. The general train of thought, especially in the kind of especially United States in our world, is that the physician is the main like head as far as like cost. Like the physicians cost so much, the physicians make so much money, they're always out golfing, and that's why everything is so expensive. And I always try to tell people, like, if they just looked at the numbers, they would see very quickly how the salaries of the physicians, the nurses, and the ancillary staff is like pennies in comparison to the administrative costs, the facility costs that really drives home these expensive hospital bills, facility bills that you guys receive at home. Now, when we look and over the past decade plus, medical bills are a top 5 common reason for someone to be bankrupt. Like, and I just want us to think about that. We're living in a nation where you getting a medical bill could lead to you getting bankrupt. Many people are one medical bill away from a financial catastrophe in their life. And we're talking about people who are insured, uninsured, it does not matter. They are one bill away from financial catastrophe. And this video here harks on such a salient point that we're definitely going to deep dive in. I'm going to actually highlight a few comments that came across the video. This came on my TikTok feed. And what I typically do, especially when I see videos like that, I don't even say nothing. Like, I just, like, if you're familiar with TikTok, I do like a duet. I just kind of stand next to the video. I may write a little caption like I did in this one, and then I just kind of let it work. And you'll see, one, it's an extremely popular video. I think at least at the time of this recording, over about 10,000 people have already saw the video. So it's an extremely popular video because it hits home. And as a physician, one who takes care of patients at all different levels. I've taken care of patients in the outpatient sector. I've taken care of patients in the acute, when they're acutely ill, stroke, heart attack, COVID. Like, I've taken care of them there. I've taken care of patients in the post-acute setting, whether it be at a long-term care facility or a rehab. So I've seen patients at all of these different levels. And something in the back of my mind always, like, that's like, unfortunately, even as a physician, in the back of my mind, I'm always thinking, man, this is costing a lot of money, because I just know it is. So let's get to the video, right? Again, it's a quick clip. I'll play it twice just so you can kind of get the gist of it. And then we're going to kind of go through the comments. And then I'm going to give you my kind of personal feedback. And again, if you're on TikTok, go ahead and follow me on TikTok. Same username, Dr. Pierre, because I actually made like, mini clips here. But this topic was so important that I figured like, I'm going to do a Real Physician Reacts for it anyway, right? And remember, especially for my YouTubers, make sure you are subscribed to our YouTube channel to check out Real Physician Reacts, or even Medicine Mondays that we drop on Mondays. And we're also looking to drop a few more things, just kind of, increase the load over there. So give me a second. Let's share this video real quick.
I'm an American without health insurance, and I recently had to spend 34 hours in the hospital. They just sent me a bill for $111,000. I was wondering if you guys would like me to make a TikTok where I call them and ask, how come for 2 Tylenol, they charged me $106?
So, like I said, let me big up myself. So, I'm gonna play that video again just so you can kind of get the gist of it, right? But she got hit with a medical bill after spending a little bit over a day, about 34 hours. And the thing that, like, not only the total of the bill, because which is kind of crazy, right? But the thing that hit on this is like, why is this Tylenol like so expensive? Like, why are you upcharging me to the wazoo for Tylenol, something that is over the counter? I can get right at, my local pharmacy, and I can get 20 of them, right, for like $10. Like, why are you charging me so much? So again, let's run this video back, and then we're going to kind of break down some of the different concerns and issues that we have, and then we'll kind of go to the comments here. So give us a second.
I'm an American without health insurance, and I recently had to spend 34 hours in the hospital. They just sent me a bill for $111,000. I was wondering if you guys would like me to make a TikTok where I call them and ask, how come for 2 Tylenol, they charged me $106?
So, okay, let me take that out of there. So, 34 hours stay, $111,000 bill, and a Tylenol for like $160, right? Like, and she's uninsured, right? So just like it's just mind-boggling. And the reason why it's mind-boggling, because for a lot of people, they don't even realize that this is reality. This, unfortunately, is not an outlier. The bill is not an outlier. The cost that they're charging for a Tylenol is not an outlier. The fact that they would send this to an uninsured patient, this full amount, and say, hey, like, how do you want to pay this, is not an outlier. And I've talked about this on my podcast, where I say a lot of times the reason why I see patients as late as I do in terms of cancer diagnosis, in terms of blood pressure diagnosis, because they've already had a stroke, in terms of kidney disease diagnosis, because now I'm about to put them on dialysis. Part of the reason why I see patients as late as I do is because of that fear that a lot of patients have, that, man, it is going to be expensive if I have to go to the doctor's office. It is going to be expensive if I have to go to the hospital. And because in the back of their mind, they're like, hey, you know what? Because it's going to be so expensive and I got to look out for my family, I'm not even going to get it checked out. Like, I got, there's some blood when I poop, not getting it checked out, right? I keep coughing up some crazy looking stuff, not going to get checked out, because they know the bill that's coming is something that they can never afford. And they don't even want to put that stress on themselves to have to deal with a fictitious bill that hasn't even got there yet. And again, this patient is uninsured. Lots of different questions, right? This patient gets to look at this bill. Lots of different questions, right? So let's go through some of the comments that my video got, and then we'll kind of give my feedback on what kind of transpired, right? So I got this one comment here, says, I have insurance. I spent 4 hours and they charged me $3,000. 4 hours with insurance, and I still got charged $3,000. And the reason why I love that she posted this, again, if you check my TikTok, you'll see who it is. But the reason why I love it is because it highlights the fact that, no, this person didn't just get a ridiculous bill because they were uninsured, even though that definitely plays a significant factor. Even a person who feels like they're doing the right thing, getting insurance, they got insurance, they just went, for whatever reason, they still got such a significant bill that in 4 hours later, their bill is still $3,000. And remember, I told you, a lot of us are one bill away from medical bill, especially really any bill a lot of times, but definitely medical bill from financial catastrophe. So here it goes. I got insurance. They still charge me $3,000. And now she talks about asking for an itemized bill, which is a very good point, because what happened, like, this has been going on so bad that they started having to enact laws that forced facilities and hospitals to actually have to give a breakdown of why you're charging me this much. Like that's why our initial woman was able to tell that Tylenol cost her $160 because she's like, no, don't just because what typically the hospitals don't do that. They'll just give you the hey, here's the cost, $111,000. And you typically have to go and request hey, give me a breakdown of every single thing that ran up to $111,000. So here, this is a $3,000 charge in 4 hours, right? Again, majority of the world cannot, especially here in the United States, cannot afford a $3,000 bill within 4 hours. They can't do it. And unfortunately, guess what happens, right? You don't pay these medical bills. You have these your hospital, your facility sends it to a debt collection agency, which then gets put on your credit. And now you have bad credit. So now here you go, going to try to take care of yourself because you were not feeling well. You get a bill that is ridiculously expensive that you cannot afford. And now you have bad credit. And remember when I talked about how in the beginning, I got a lot of people who do not come to see me in the hospital, who do not come to see their primary care doctor for fear of getting a bill that they can't afford. And now let's say they get over the hump and they get a bill that they now can't afford. Now it's detrimental to their credit. Now they can't apply for that loan. Now they can't get that mortgage. Now they can't get that car, right? Some places you can't even open up an account. Like it is detrimental to the fullest. I remember, I didn't even realize it, right? I should have known no better. When I was in undergrad, I was applying for a job at a bank. I was like, oh, I want to work at a bank. Didn't realize that you actually needed very good credit to work at a bank. Like having bad credit, disqualified me from working at a bank. I'll be honest, I had bad credit. I'm sorry. I was swiping cards, didn't know no better. I was young. But having bad credit means I couldn't even work at a bank, and they were hiring. But because my bad credit, I was posed as a risk. Again, drop in the comments, right? If you couldn't work anywhere, right, because your credit was bad. If you couldn't get a house because your credit was bad, right? If you couldn't get a loan because your credit was bad. And this all started because you say, you know what? I'm not feeling well. I need to take care of myself, right? So again, and this is not shocking, not surprising, but I wanted to point out this fact is because a lot of people I saw driving home the fact that the patient was uninsured. Our first one was uninsured, and that's why the bill was so high. Nah, you could be insured and still get a ridiculous bill. And then this question here, this was a very multi-layered question. Actually, my response video was about 3, because this typically, and on TikTok, you can do 15 seconds, 30 seconds, or 15 seconds, a minute, or 3 minutes max, right? So this one was a longer because it had so many different layers, right? So first, this commenter is saying, well, how come you're not insured? Because obviously they're thinking that, isn't everyone insured? And a lot of times people don't realize that there are a lot of people who live in a reality where being insured is prohibitive to them eating. Being insured is prohibitive to their kids getting clothes for school. Being insured is prohibitive for them being able to put gas in their car to go to work. Because for some people, right, again, especially again, this is more of the empathy related issue. But for some people, they don't realize that it's not everyone's not able to do so. And then especially when we talk about being insured, the Affordable Care Act, because that definitely came up on a lot of comments. We have to understand that it is very state specific, especially with the Affordable Care Act, because we know I'm in the shitty state of Florida where our governor refused to expand Medicaid, refused a lot of benefits that would have lowered our cost, which then drove a lot of insurers out of the Affordable Care Act plans. And if you got 1 or 2 people who do all the Affordable Care Act plans, guess what? They're able to charge more, and they will charge more. Why? Because they're the ones taking on all that risk. Versus if you had more, competition, they couldn't charge as much because, the next company over here is charging less, right? And a lot of people are living in states where their governor said, we don't want to expand Medicaid. And in that same breath saying, look how expensive Affordable Care Act plan is, right? Again, politics, not medicine, right? But that just is what it is. So they said, why aren't you insured, right? And again, like I said, it's just that dichotomy, not understanding that not everyone can afford to be insured. And, they struck down the individual mandate a few years ago, right? So it's not a guarantee that you are going to be insured for your health. Is it hard to get signed up through the Affordable Care Act plan? Again, obviously, this new president has done so much of a better job, bringing out information, publicizing information so people could get signed up. We remember the last administration did a great job trying to not only shorten the window where you could apply for insurance, but wouldn't advertise it anywhere. So you didn't even have no clue that it was available to be applied to. Right. So again, we've had a great reversal, but again, it's not as easy, right? It's not as easy because again, at the end of the day, cost is everything. If I got to choose, right, to feed my kids versus, protecting myself in wellness, yeah, I want to do that, but my kids have to come first. My family has to come first. I got to take care of them first. So unfortunately, I'm going to let my health insurance and the protection I need for my health insurance take a backslide. And does your work not give you insurance, right? So important aspect as well. We know with the Affordable Care Act plans, it required that if you were a company that had, I think it was 100, let's say 100 people, 100 people working for you and they're full time, you had to give them insurance. But guess what? What do we? If people don't even remember, what do you think companies started doing when the mandate said, hey, if you have employees who work full time hours, you have to insure them. And you have to pay for it. Guess what they started doing? They stopped giving y'all full-time hours, right? So they purposely gave you less and less hours, aka your money went down, less and less hours, just so they didn't have to pay for insurance. Or they made you independent contractors, which again made you responsible for insurance and not them. Right. So just a dirty game that got played, unfortunately. And again, especially when we talk about health and politics and how unfortunately they're married together. So this is definitely a multi-layered question on the why. But once we kind of understand, right, especially again, you understand all of the different factors that it takes to get insured. Right. You got to go online. You got to go to your website. You got to do all these things there. But maybe you don't have access to people who can fill out the paperwork for you. Maybe you don't have access to a computer to go online. Maybe you don't have that access. And then even if you do have the access, if you don't have the financial means to do so, it don't matter. If you stay in a city state like Florida, where our premiums are super high because our governor refused to expand Medicaid and take on a lot of other benefits that would have decreased our costs, it doesn't matter, right? You're not going to be insured and you're just kind of rolling the dice and hoping that you don't get sick. You know how many people who are probably watching this video, who will watch this video, are just praying to God they don't get sick? They're like, God, please, just I don't want to get sick. I just don't want to get sick, because they know they can't afford it, right? They know they can't afford the issue of getting sick. Like, especially COVID was a big thing, right? COVID was a huge thing because if we remember initially, because when we had no viable treatment options, right? We didn't have the FDA approved treatment options. Everything was kind of experimental. If you got admitted to the hospital for COVID, your hospital stay was actually covered 100%. Because they're like, man, there was no way you could possibly prevent this. So, we're going to cover you 100%. But guess what happened after they started getting viable treatment options? Guess what happened, especially once they started getting vaccines? The companies and insurance companies started looking at you like, say, hey, if you get COVID and all of the risks associated with COVID and you're not vaccinated, you're getting that bill. Like, we're not going to eat that bill up anymore. The government's like, hey, we're not paying for that anymore. So when you saw a lot of these people saying that, unfortunately, and this, let me show you how dirty politics is, right? Let me take this out. When you saw a lot of people swearing that doctors were getting paid, right, to write COVID as a diagnosis, that was the underlying theme. It was that because if you had a COVID diagnosis, the federal government absorbed the cost because we didn't have no treatment. We didn't have the viable treatment options at the time. So the federal government said, yeah, I'll take that. I'll absorb that. Hey, hospital, I'll take that. So that's why people started interpreting like, oh, the hospitals and the doctors are in with pharmaceutical company or whoever we're supposed to be in with to say everyone has COVID so that all of the bills get paid by the federal government and not them, right? Which is just a level of craziness that, like, you almost have to say that loud, right? And people still, you're like they actually thought that. Like, that is, this blows my mind. Craziness, right? So let's go in this comment here. The Affordable Care Act is a joke. They wanted $700 per month just for my husband, and the benefits were not that great to add them to my policy. So again, this is what I kind of talked about. I kind of alluded to, right? The Affordable Care Act, again, I might have to do a video to kind of talk about what insurance was like before the Affordable Care Act, because I know a lot of people don't realize just how terrible these insurance companies were before the Affordable Care Act. You have certain party affiliations will have you believe that insurance did not get expensive until the Affordable Care Act, that healthcare bills were not expensive until the Affordable Care Act. Certain party affiliations will actually have you believe in that. And because they want you to blame everything costly and negative to the Affordable Care Act and not the system of health insurance and the hospital facilities and everything else. Like, that's just a rationale. So you hear the Affordable Care Act is a joke. They wanted $700, right? So of course I kind of responded and said, unfortunately, this is a multi-layered question. One, I got to figure out what state are you living in? Because we know that the state that you're living in, if your government, your governor and everything say, you know what, I'm not going to expand Medicaid. I'm not going to encourage more competition within the marketplace. I'm not going to do the things that I know will drive down cost of insurance premiums. And I know that they're just going to pass it on to you. If you live in that state, yeah, your insurance probably costs you, they wanted $700 more. Like, that makes 100% sense in the world. Right. And again, obviously, we don't know any medical history or anything else that may have added to the $700. But if we just kind of think in a general sense, hey, you know what? You're already in, again, let's say I always like using the state of Florida because this is my state. You're in the state of Florida. Your governor said they weren't going to expand Medicaid, and that drove competition away from the marketplace. So you only have like one or two companies within the marketplace that give insurance for everybody. And because they have to absorb costs, they raise their premiums up like crazy. Like, if you're in one of those states, it's going to be more expensive. It just is what it is. But you can't blame the Affordable Care Act, right? You have so many other different layers to blame before that. But again, that was a question as well. Again, this is one of those like, hey, I'm insured, but insurance is still expensive because, the hospital bills and the hospital expenses are still expensive, right? Again, just driving home that fact that, yes, being uninsured definitely makes it so that you have expensive bills. But definitely, if you're insured, don't think that just because you're insured, your hospital bills are chilling, right? Because there's a lot of people who are underinsured as well, right? We talk about an uninsured patient. I don't got no insurance. We talk about an insured patient. Yeah, I got some insurance, but underinsured means, yeah, I got some insurance, but they don't really cover nothing. Right, my hospital deductible is still $8,000. All the, like, again, we can get down to the weeds, but again, that just is what it is. This question here: did they not offer you a sliding scale discount application? Right, so good. We're not sure, especially at the level of our original patient where she was at. But I always tell, because I just had to deal with this with my wife. What typically happens is these in facilities and all these places, they just send you the bill first, right? Especially if you're uninsured, they're sending you the bill. Like, hey, boom, here's the bill, right? Because they want you to come and reach out to them and say, hey, man, I can't afford this. Like, what are you doing? Like, I can't afford this. And then they say, okay, well, if you can't afford this, what can you afford? These are some options we have. But like right off the rip, oh, no. You're getting that $111,000 bill for 34 hours. Right off the rip, you're getting that bill. And then if you need some charity, because that's how they call it, if you need some charity, then you can come back, ask us. We can see if we could work the middle somewhere, right? But like definitely off the first rip, unlikely that you're going to get the sliding scale discount application for an uninsured patient, because they just assume like, hey, we're just sending this crazy bill and they'll call us. But you know what a lot of patients do? They get that crazy bill, $111,000, trash. And that's the worst thing to do, right? Because guess what happens, right? They say, oh, well, we sent them the bill. They ain't want to pay for it. Hey, collection agency, go get our money. Like we're gonna write off the debt. This is dirty game. We're gonna write off the debt, right? We're gonna write off that $111,000 on our balance sheet. We're gonna save some taxes on it. We're gonna send it to a debt collection agency. Say, hey, the debt collection agency probably pays pennies on the dollar for it. And then the debt collection agency is gonna come to you and say, hey, give us our money. And it's not even their money, because to mind you, the debt collection agency is not going to pay $111,000 for that note. They may pay $1,000. I don't know, but let's say they pay $1,000, but they'll tell you, hey, you still owe $111,000. Think about that. They will still tell you you owe $111,000. Pay us our money. And now we're going to put your stuff on credit. So now you got a credit report that says you owe $111,000 to this debt collection agency. And they want you to go to them and say, all right, man, I don't got the $111,000. Well, how much you got? You got $10,000, you got $5,000, you got one. All right, give us that $10,000. Now, mind you, they just paid $1,000. Again, I'm just hyperbolist. I don't know. Right? They just paid $1,000 for your note, but they were able to get $10,000 off of you. Now they've made $9,000, $10,000. Again, I'm just shooting numbers, but they've made profit because of the fact that you want to get that hospital bill, that collection bill off of your credit report. Right? It's a dirty game, right? Because you're like, let's say Wellington Regional, right? Wellington Regional can't necessarily put that bill on my credit report, right? You can't do that. But if Wellington Regional sells it to a collection agency, the collection agency can put that on my report. Yeah, dirty game. Dirty game. But again, what I'm hoping, right, and I think she's going to make subsequent videos. What I'm hoping is that the subsequent, like when she talks to them and say, hey, y'all charge me like $160 for 2 Tylenol, that ain't going down. Let's be for real. Then you'll start seeing like, all right, hey, yeah, we sent it to you for $111,000, but maybe we can take this off. Don't charge you this, charge you cash. Like all of a sudden you'll see that $111,000 turn to like $25,000, like pretty quickly. And that unfortunately is a process of the system. That is the process of the system where they know if you are insured, they could send that $111,000 bill over to the insurance company. The insurance company is like, ha, nice try. This is all the money you're getting from us. Right. And then they say, okay, that's fine. And then some may go and try like, all right, let's see if we can collect the rest from the patient. Others may be like, all right, we're fine with that. Right. Just a dirty game right here. And this is kind of what I kind of mentioned, the overlying theme of what happens for a lot of people. This will happen for a lot of people. Again, if you're in this situation, ever been in a situation, someone in this situation, drop it in the comments, right? Her healthcare cost was about $900 more than my mortgage. How is that fair? It's not. It is not that we're at the point where being insured costs more than living in your residence. That is a scary time. And again, and this is why I say when people say, well, how come you aren't insured to my uninsured patients? I'm like, because they decided that they would rather live somewhere than pay a bill for the protection that if something were to happen, they would have a decreased cost, because it's not 100%. It's not 100. Again, unfortunately, again, especially you have the best insurance. It's not like the insurance is covering 100%. It's usually 100% after you pay your deductible. And depending if you don't know any better and you're just looking for a lower premium insurance, that means your deductible may be $5,000, $6,000, $8,000. How many people, again, comment in the chat, how many people have $5,000, $6,000, $7,000, $8,000 just lying around to be able to pay a deductible? So if you don't have that to be able to pay the deductible, like who cares that the insurance your insurance company will cover 100% afterwards? Fam, I don't have the $8,000 in the first place. And if I'm uninsured, there is no insurance company that will cover 100% after I pay my $8,000. Because one, I don't have the $8,000, and guess what? I don't have an insurance company who's going to cover the rest. So I'm stuck. With this entire bill, right? And just this hit home, because this is how majority of the patients I usually take care of feel, right? Like I got to make a choice. Yeah. I got to make a choice whether I eat or I have health insurance, whether my kids eat or they have health insurance, whether I can put gas in my car or go to work or have health insurance, right? People every day are making this decision every day. Like you pull up into the gas station right now and you look, and the person before you, they had to put like $5 in the tank, $3 in the tank, $2. They just needed enough. They just like, hey man, I might not get paid till Friday. I just need enough to get to work and back, and I'll deal with it then. I remember man, right? Remember, full disclosure here. I remember never taking this out. I remember when I was an undergrad, right? Because I was poor. I broke. But I knew that if I had $1 on my my debit card, I knew if I had $1 on my debit card that I could swipe credit at a gas station. And if I swipe credit at a gas station, they'll let me fill it up. So I can swipe the $1, even though I may have $1.50. I swipe that $1 credit. They check. They like, oh yeah, he's got at least $1. I fill my gas tank up, knowing that when it finally hits the full bill, I may be overage, but I'm praying that by the time they actually credit to my account, my paycheck comes in that Friday and I'm able to kind of make it. This is real life decisions that people have to make every day. And I don't think people realize that, right? So that's why when I saw that video and I said, oh, this is the reality that I live in. And I'm the physician. Right. And I'm the physician who a part of that $111,000, it might be a line item that says, hey, the physician charged you for the visit. His part was like $200, $300. You still owe $111,000. But, the doc who saw you, who saved you, who did what they needed to do. Their fee is $300, $400. Right. Just a different level of craziness that is out there, for the world to see, man. So again, this was a good one, right? Good one. Again, sorry, last week I was on nights, right? So we couldn't do a live because video quality and everything else, and it was just kind of crazy week at work. So I'm gonna see you guys next week. Make sure you are subscribed to our YouTube channel, Dr. Barry Pierre TV. Just search Dr. Barry Pierre, and I pull up. You guys be blessed, and y'all have a great day. Have a great